Governor General's Deputy, Sir Claire Roberts. We may sit down. May I ask everyone to kindly take their seats so we can start with the program this afternoon.
Good afternoon to all. Welcome to this side event, Uniting the Americas for Mental Health from Commitment to Action. I am Sir Malwin Joseph, Minister of Health of Antigua and Barbuda. On behalf of the government of Antigua and Barbuda, I am pleased to welcome you to this event, which is jointly sponsored with the Pan American Health Organization as an official event, the 55th regular session of the General Assembly of the Organization of American States, and I acknowledge our distinguished speakers and attendees. It is now widely recognized that there can be no health without mental health. However, mental health is not only a health issue, but a fundamental pillar of social and economic well-being and development at the national and regional levels. The government of Antigua and Barbuda and PAHO are hosting this session, Uniting the Americas from Commitment to Action, to inspire the leadership on this very important topic across sectors in order to identify unifying perspectives on advancing mental health as an integral issue both in the region and globally. In today's session, we will hear from heads of state, ministers of government, leaders of multilateral regional organizations, health authorities, and ambassadors speaking on the urgency of tackling mental health conditions in the Americas and highlighting the way forward. It is now an honor for me to introduce the Honorable Gaston Brown, Prime Minister of Antigua and Barbuda, who will deliver the keynote address.
Thank you, Sir Malwin. Sir Claire Roberts, Governor General's Deputy, Excellencies, distinguished ministers, colleagues, and friends. Today, we gather under the banner, Uniting the Americas for Mental Health, from Commitment to Action. We stand at a moment when a grave crisis, long hidden in plain sight, demands our collective resolve. Acknowledge the indispensable work of the Pan American Health Organization in tackling this issue. PAHO has been tireless in developing best practices, gathering data, and supporting country-level interventions. PAHO's leadership has already saved countless lives. Today, we support the acceleration of PAHO's efforts to save many more. Colleagues, mental illness is not an abstraction. Each of us knows someone, a neighbor, a friend, a family member who struggles silently. Yet too often, mental health is relegated to the margins and its sufferers dwell in the shadows. This must end now. In Latin America and the Caribbean, more than 10 adolescents die by suicide each day. In 2021, 16 million adolescents across our region live with mental health disorder. These figures represent lives overshadowed by despair, potential left unrealized, families hollowed by grief. UNICEF estimates that untreated youth mental health conditions cost Latin American and Caribbean economies over $30 billion annually, borne by parents who cannot work, by children who struggle in school, and by communities that lose hope. Across our hemisphere, 7 out of 10 individuals in need of mental health care receive no counseling, no medication, no community support. In Antigua and Barbuda and other Caribbean states, many endure symptoms in silence or travel abroad for services they cannot find at home. This disparity is unacceptable. Every human being, regardless of geographic location or income, deserves access to quality mental health care. In the United States, economic losses due to mental illness reached $193 billion in 2008. By 2024, a study by Columbia, Yale, and Wisconsin universities raised that figure to $282 billion annually. These losses manifest as absenteeism, truancy, reduced productivity, disability payments, and the cost of homelessness and incarceration. If we continue investing, these drains on our economies will deepen. These cascading effects transform individuals' suffering into community crises. When we neglect mental health, we do not save money, we invest in failure. Distinguished colleagues, behind each statistic lies a human story. A teenager in Brazil who cannot concentrate because panic grips her heart, a farmer in Guatemala battling depression alone, and a mother in Jamaica watching hopelessly as her son's schizophrenia worsens for lack of treatment. Without urgent action, these stories will multiply. The OAS General Assembly, which starts this evening, will adopt a resolution that Antigua and Barbuda was proud to pilot through its successful negotiation process. Entitled, Addressing the Critical Mental Health Crisis in the Americas, the resolution commits us to mobilize resources for mental health awareness, fund scholarships in psychology and psychiatry, and establish clinics that integrate mental health screening into primary care. It affirms that mental health is as vital as physical health. Adopting this resolution is an important first step. But to make this vision real, we must embed mental health care into primary healthcare systems, ensuring screening is as routine as checking blood pressure and blood sugar. We must train doctors, nurses, and community healthcare workers to detect early warning signs, and adolescents' sudden withdrawal, a parent's persistent despair, and create pathways to psychiatric services without delay. In many communities, individuals hesitate to seek help because they believe that no one understands. We must rebuild trust by ensuring that care is available and compassionate. The COVID-19 pandemic exposed glaring weaknesses in our health systems, and mental health was among the most under-resourced sectors in Latin America and the Caribbean. The WHO's pandemic agreement, adopted last month, called for equitable access to clinical care and essential health services, emphasizing mental health and psychological support. Those of us who continue to be members of the WHO must act on this summons and strengthen our systems now so that we can withstand future crises. But policies alone will not suffice. We must rekindle community bonds. Schools must teach emotional literacy alongside academic courses. Workplaces must offer counseling. Neighborhoods must create support groups and safe spaces. Faith-based organizations and civil society organizations must host dialogues that overcome stigma and fostering understanding. Families and caregivers are often the first line of defense, yet they receive little guidance. We must equip them with resources, including workshops, manuals, and online portals, so that they can learn how to recognize mental distress and to respond to crises and foster healing. When parents understand the biology of depression and siblings learn to communicate with a loved one living with bipolar disorder, families become sources of resilience rather than isolation. I speak from personal experience. My sister and I witnessed stigma's cruelty when our late mother struggled with mental health challenges. Society whispered judgments, but in our home, love prevailed. We refused to let scorn define her worth. From her struggles, we learned resilience, empathy, and the transformative power of compassion. In her memory, and certainly in the memory of hundreds of thousands like her, we must dismantle every wall of shame and build bridges of understanding. Ministers, colleagues, and friends, the time for transformative action is now. We can continue to ignore mental health, paying for the neglect with shattered lives, fractured families, and economies drained by lost potential. Or we can choose a different path, one that recognizes mental health as a cornerstone of human dignity and societal well-being. By pooling our resources, expertise, and resolve, we can ensure that every person in the Americas has access to care and compassion. We must build inclusive, resilient healthcare systems that treat mental health as indispensable. We must dedicate funding that reflects the true human and economic costs of mental health needs. We should understand that 2 or 3% of health budgets is insufficient. It is a decision to allow suffering and loss to continue to grow. Regional collaboration is key. Together, we can establish a regional research and developmental center, as well as an observatory to collect data, track trends, and measure progress, utilizing AI and other technologies. We can forge public-private partnerships, inviting corporations to invest in employee wellness programs and university scholarships, knowing that healthy minds yield healthier businesses and more resilient economies. Let us transform commitment into measurable action. I call on all participants in this event to link their deliberations with the United Nations 4th high-level meeting on non-communicable diseases and mental health, which will be held in September this year on the margins of the UN General Assembly in New York. That meeting will adopt a new political declaration, setting a global vision for promoting mental health to 2030 and beyond. Our collective momentum here in Antigua and Barbuda must carry forward to New York, ensuring that the commitments we forge today inform and strengthen that critical global dialogue. The Americas possess the creativity, resilience, and compassion to make a difference. Let us seize this moment. Let's develop a culture of love for our shared humanity, empathy, and support for those with mental health challenges to end the stigma, condemnation, isolation, and rejection. Together, let us work towards a future where mental health is given the investment it deserves to achieve the well-being of each person and the prosperity of all our societies. Thank you.
Thank you, Your Excellency, your personal commitment to bettering mental health in the region is inspiring and has made today's event possible. I am now pleased to invite His Excellency Albert Ramdin, Secretary General of the Organization of American States, to the podium.
Mr. Chair, thank you very much. Minister Joseph, Sir Claire Roberts, Deputy Governor of Antigua and Barbuda, Honorable Prime Minister, Your Excellencies, Honorable Ministers, distinguished delegates, ladies and gentlemen. Allow me to begin by extending my heartfelt gratitude to our co-host, the Government of Antigua and Barbuda, and the Pan American Health Organization for bringing mental health decisively onto the hemispheric agenda. I'd like to especially commend Prime Minister Gaston Brown for his leadership and vision in championing this crucial cause. I'm honored to join you in shedding light on a topic that is often overlooked. And I stand before you today not only to advocate for greater awareness, but to reaffirm our collective responsibility to act on issues that are affecting the welfare and wellness of the citizens of our hemisphere. Mental health and the impact of those contending with the impact is, in this day and age, still a very stigmatized topic in our societies, but unfortunately ever present. At the Organization of American States, our work is guided by 4 pillars: human rights, democracy, multidimensional security, and integral development. The topic of mental health has a reach amongst various of these pillars. Mental health is a right, is not a privilege. This is recognized in the Inter-American Human Rights System through the Protocol of San Salvador, which frames mental, physical, and social well-being as essential components of the right to health. Yet millions across our hemisphere continue to face stigma, discrimination, and systemic barriers to care. Last June, our General Assembly marked a pivotal moment with the adoption of Resolution AG-RES 3028, which critically includes a section on human rights and mental health. We must, all of us, we must now focus on translating that resolution and our broader commitments into concrete policies and actionable initiatives, adequate resource mobilization, and accessible services that truly improves people's lives. Mental health is not only a matter of individual well-being. It is deeply linked to peace and social cohesion of our respective societies. The social determinants and risk factors that shape mental health, exposure to violence, chronic stress, substance abuse, and poverty, among others, are often the drivers of insecurity and conflict in our communities. Strengthening mental health systems and providing psychosocial support are essential to building safer, more cohesive societies. Ladies and gentlemen, it goes without saying, poor mental health can compromise national and regional growth and sustainable development. Mental health challenges undermine educational attainment, decrease workforce productivity, and contribute to poverty, homelessness, and incarceration. The economic impact is staggering. Untreated mental health conditions are projected to cost the global economy $16 trillion by 2030. And the World Bank estimates that depression and anxiety alone cost the world over $1 trillion each year in lost productivity. The takeaway is clear. Investing in mental health is not just the right thing to do. It is a necessity to invest strategically in human capital, economic growth, and resilient communities. Mr. Prime Minister, distinguished ministers, we can no longer afford to treat mental health as a secondary concern or leave it solely to the health doctor, as the Prime Minister just mentioned. Mental health is a cross-cutting issue that touches every home, every school, and every workplace. It must be shared. It must be a shared priority that demands leadership and resolve. And action is within our reach if we work together. We need whole of government and whole of society strategies that integrate mental health into all aspects of public policy, across education, labor, housing, justice, and security and medical care. We must recognize that prioritizing mental health is a direct investment in the well-being and prosperity of countries in the region and fundamental to our mission at the Organization of American States. As global leaders prepare to convene at the United Nations this September for the 4th high-level meeting on the prevention and control of non-communicable diseases and the promotion of mental health and well-being, our region has a real opportunity to shape the global mental health agenda for 2025 and beyond. Our collaboration will be key, not only to advancing mental health across the hemisphere, but to inspiring many meaningful progress around the world. From the outset of my tenure as Secretary General, I have emphasized the need to strengthen regional partnerships. The alliance between the Pan American Health Organization and the Organization of American States is a model of the kind of strategic partnerships we need. Combining PAHO's technical leadership in public health with the OAS's broad mandate across democracy, human rights, security, and development will most certainly help mobilize political will, align resources, and turn shared commitments into meaningful and lasting action. In closing, I would like to acknowledge from within the organization the outstanding leadership provided by our Assistant Secretary General, Nestor Mendes, whose tireless efforts have shaped and advanced the OAS collaboration with the Pan American Health Organization with regard to this topic. I'm committed to building on his legacy and further strengthening our partnership, because ultimately, to protect democracy, uphold human rights, strengthen security, and drive development, we must care for the minds, the hearts, and the lives of our people. So let us move forward with urgency, with compassion, and with courage. I thank you very much.
Thank you very much, Your Excellency. We congratulate you on your recent election as Secretary General and are pleased to have you identify mental health as a priority for the region. In this next panel, His Excellency Nestor Mendes of the Organization of American States and Dr. Anselm Hennis of the Pan American Health Organization will speak on challenges and opportunities in mental health in the region of the Americas. I now give the floor to His Excellency Ambassador Mendes, Assistant Secretary General of the OAS and co-chair of the PAHO High-Level Commission on Mental Health and COVID-19.
Thank you very much, Mr. Minister. Sir Claire Roberts, Governor General's Deputy of Antigua and Barbuda, Honorable Prime Minister Gaston Brown, Sir Malwin Joseph, Minister of Health, Wellness and Environment, distinguished ministers, Secretary General of the OAS, Ramdin, Dr. Anselm Harris, Director of the Department of Non-Communicable Diseases and Mental Health of PAHO, ambassadors, esteemed guests, delegates, welcome. I wish to express my sincere gratitude to the government of Antigua and Barbuda and the Pan American Health Organization for co-hosting this important event, an event that seeks to respond to one of the defining public health challenges of our generation. I also wish to thank all the presenters and participants joining us this afternoon who accepted our invitation and will be participating in this critical dialogue. According to the Pan American Health Organization, as of August 2nd, 2023, the region of the Americas reported a cumulative total of 2,958,859 deaths due to the COVID-19 pandemic since the beginning of the pandemic. Beyond its devastating human toll, the pandemic also tore away the veil that had long concealed a silent mental health crisis affecting our communities for decades. In 2020 alone, depressive disorders surged 35%, and anxiety disorders 32% in Latin America and the Caribbean. The burden fell most heavily on already marginalized populations, while essential public mental health and substance use services faced major disruptions. The pandemic did not create this crisis. It simply exposed it. And it showed us how important mental health is, how mental health challenges can affect us all, and it showed that health systems in the region were not prepared to handle a growing mental health crisis. To confront this reality in 2022, the Pan American Health Organization invited me, alongside former Vice President of Costa Rica, Epsi Campbell-Barr, to co-chair its newly established High-Level Commission on Mental Health and COVID-19. I was honored to help lead this initiative, which brought together experts from national governments, health organizations, academia, civil society, and critically, people with lived experience from across the region. Together, we undertook the important and ambitious task of providing guidance to the Pan American Sanitary Bureau and PAHO member states on improving mental health systems and services during and beyond the pandemic. Over the course of 1 year, the Commission worked tirelessly to assess the impact of the pandemic in the context of the region's pre-pandemic state of mental health, convened technical working groups to examine key priority areas, and engaged a wide range of stakeholders and experts in meaningful consultation. In June 2023, the Commission presented its report, A New Agenda for Mental Health in the Crisis, a report outlining 10 concrete recommendations to help the region rebuild stronger, more inclusive mental health systems in the aftermath of the pandemic and for the years ahead. These practical recommendations, which place equity and human rights at their core, underscore the urgent need for multi-sectoral partnership and collaboration to address poor mental health, well-being, and their social determinants comprehensively and effectively across the region. Among the recommendations, 3 of them underpin all the recommendations and are especially relevant to the discussions today. 1, elevating mental health at the national and supranational levels by ensuring it is placed on political agendas, recognized as a priority, and advanced through strategic partnerships at the national level and beyond. 2, integrating mental health policies into all policies, not only within the health sector, but across all areas of public policy, including emergency and disaster response. And 3, increasing both the quantity and quality of mental health financing to ensure that investment in mental health matches the demonstrated burden in our region, and that it goes to evidence-based interventions grounded in human rights. A central message emerging from this work is very clear. To achieve the mental health goals of our region, we need a mental health in all policies approach. This means embedding mental health considerations across all areas of public policy. For example, health policies that integrate mental health into primary health care are cost-effective, expand access to mental health services, and improve overall health outcomes, not only for mental health conditions, but also for chronic diseases. Workplace mental health initiatives can reduce absenteeism, boost productivity, and support broader economic growth. Also, school-based mental health programs can prevent and identify mental health conditions early, when many of them first emerge, thereby improving the health and well-being of populations and generating far-reaching social and economic benefits. These, ladies and gentlemen, are not aspirational ideas. Several of our member states are already seeing measurable gains where such models are in place. My experience with the Commission opened my eyes to the urgent situation of mental health challenges facing the region. It also made clear that these challenges and needs are not limited to the field of mental health or even only to the health sector. They are inextricably connected to our work at the OAS. We cannot meaningfully speak of integral development, human rights, security, or equity without addressing mental health. The Commission has provided us with a clear and actionable roadmap, but implementation rests with all of us, with governments, with multilateral institutions, with civil society, with communities, with the private sector, working across sectors, systems, and borders to move beyond diagnosis to action. I am deeply grateful for the opportunity to share these reflections. Leading this work with PAHO has been one of the most meaningful experiences of my time at the OAS, and I am confident that it will strengthen the ties between our institutions for years to come. Though my term as Assistant Secretary General is soon coming to a close, I reaffirm my unwavering commitment to the mission of the OAS and PAHO, and to advancing the recommendations of the PAHO High-Level Commission on Mental Health and COVID-19, so that all people in our region can live with dignity, support, and the opportunity to thrive. Thank you.
Thank you, Ambassador. And we congratulate and thank you as you conclude your term as Assistant Secretary General of the OAS. I will now give the floor to Dr. Anselm Hennis, Director of the Department of Non-Communicable Diseases and Mental Health of the Pan American Health Organization.
Good afternoon. Sir Claire Roberts, Governor General's Deputy of Antigua and Barbuda, Honorable Gaston Browne, Prime Minister of Antigua and Barbuda, Excellencies, esteemed delegates and guests, ladies and gentlemen, it is my pleasure to present a video address from Dr. Jarvis Barbosa da Silva, Jr., Director of the Pan American Health Organization.
Your Excellency, Honorable Gaston Browne, Prime Minister of Antigua and Barbuda, Mr. Albert Randin, Secretary General to the Organization of American States, OAS, Mr. Nestor Mendes, Assistant Secretary General to the OAS, ministers and other heads of delegation of member states of the Organization of American States, ladies and gentlemen. It's an honor for me to address you at this 55 General Assembly side event, Uniting the Americas for Mental Health from Commitment to Action. I'm very pleased that mental health has been given an unprecedented position of importance in this regular session of the OAS General Assembly. The Pan American Health Organization, PAHO, recognizes mental health as a top public health priority for our region. In this regard, I must extend a special acknowledgement to His Excellency, the Prime Minister Gaston Brown of Antigua and Barbuda, for his initiative and commitment in spearheading this significant work, and to His Excellency, Sir Ronald Sanders, Ambassador of Antigua and Barbuda, for his sustainable efforts, as well as to the significant contribution of the distinguished speakers on this panel from our member states. I will now switch to Spanish. La salud mental sigue siendo una de las áreas más desatendidas en las Américas, donde los trastornos mentales y el suicidio representan algunas de las principales causas de discapacidad y mortalidad. Los trastornos mentales graves pueden reducir la esperanza de vida hasta en 2 décadas, y el impacto de un tratamiento inadecuado de estos trastornos va más allá del sufrimiento incalculable de las personas directamente afectadas y sus familias, afectando también al desarrollo del potencial humano en nuestras sociedades. Para avanzar hacia una región más próspera en la que todos podamos alcanzar el más alto nivel de salud posible, no podemos seguir tratando la salud mental como un problema sanitario aislado. Por el contrario, debemos reconocer el papel fundamental que desempeña la salud mental en el fortalecimiento del capital humano, la sostenibilidad económica y el bienestar y crecimiento sociales. Para lograr esa meta, debemos trabajar juntos. Em nome da Organização Pan-Americana de la Salud, OPS, desejo felicitar a la Organización de los Estados Americanos, la OEA, nuestra hermana en el sistema interamericano, por los importantes pasos que ha dado en la promoción de la salud mental en nuestra región. En el espíritu del panamericanismo, la OPS reafirma su compromiso de apoyar a la OEA para lograr uma visão compartida de bem-estar e prosperidade para todos, sem deixar a nadie atrás. Recordemos que não há saúde sem saúde mental. Muitas gracias.
As the esteemed speakers who preceded me have affirmed, the Americas is experiencing a mental health crisis, the impacts of which transcend health and threaten our development and prosperity as a region. We must acknowledge that the costs of not effectively addressing this crisis are too high to bear. However, a business-as-usual approach to mental health, one in which the health sector shoulders all of the responsibility, cannot be the solution. As we have heard, mental health is integral to all aspects of our regional well-being, including our social and economic development, human rights, and security. Improving mental health in the region thereby necessitates the partnership, collaboration, and investment of each and every sector, all of whom stand to reap the benefits of better mental health. The Americas has an important history of mental health reform that we must leverage to accelerate our progress. Working together, countries in our region have and continue to shape not only regional, but global mental health policy. From the groundbreaking Caracas Declaration in 1990 to the approval of the strategy for improving mental health and suicide prevention in the region by the Pan American Health Organization's 60th Directing Council. As Ambassador Mendez indicated, the pivotal work of the High-Level Commission on Mental Health and COVID-19 has laid the groundwork. With PAHO's guidance, countries are already taking significant steps to implement the Commission's recommendations by enacting modern, rights-based mental health legislation, expanding access to mental health services in primary health care and in the community, and reducing deaths by suicide through evidence-based strategies, among other notable efforts. But without greater commitment, collaboration, and action across sectors, we can only go so far. I commend today's side event for placing mental health prominently on the inter-American political agenda. United, we can succeed in building healthier, more prosperous communities for our peoples in our region. Thank you.
Thank you, Dr. Hennis, and a special thank you to Dr. Barbosa for his contribution. I note that PAHO Executive Committee is also taking place at this time, and so Dr. Barbosa was not able to attend. We are grateful to PAHO for co-organizing this event and for its work in the area of mental health. I would once again like to thank both of our panelists, Ambassador Mendez and Dr. Hennis. Now that we have heard from regional leaders on the situation, challenges and opportunities for addressing mental health in the Americas, it is important to see how countries are taking action to improve mental health for their populations. This panel on mental state and member states' experiences, policy achievements, and lessons learned will showcase the experiences of countries in the region in implementing policies to advance mental health. I would like to introduce a video address from His Excellency Gabriel Boric, President of the Republic of Chile.
Muy buenas tardes a todos y todas. Agradezco a la OEA su invitación a compartir nuestra experiencia sobre lo que estamos haciendo en Chile para hacer de la salud mental un derecho para todas las personas. Para ello, es fundamental trabajar sobre dos dimensiones: el cambio cultural y las políticas públicas. Lo primero es transformar la mirada de la sociedad sobre la salud mental, para que ella deje de ser un tabú y empiece a ser un derecho. Que se deje de discriminar. Esto es parte, por ejemplo, de contar nuestras propias experiencias y de defender públicamente que toda persona puede necesitar y pedir ayuda en materia de salud mental, porque la salud mental existe, y sin que esto sea visto como una señal de debilidad, algo invalidante o algo que debe mantenerse oculto. Todo lo que ha hecho la Organización Panamericana de Salud en esta materia, incluida esta reunión de la que ustedes son parte y la resolución que nuestros estados han acordado en el marco de esta Asamblea General, avanzan justamente en esta dirección. Sin embargo, el cambio cultural estaría incompleto sin políticas públicas universales y bien financiadas que vayan haciendo realidad el derecho a la salud mental. ¿Qué es lo que estamos haciendo allí? En nuestro gobierno hemos aumentado de manera importante el presupuesto para la salud mental. Esta inversión se refleja en decenas de salas y equipos multidisciplinarios para atender a personas con trastorno del espectro autista, además de promulgar la ley que reconoce y saca de la invisibilidad a las personas con espectro autista. También en 15 nuevos centros de salud mental que van a quedar habilitados al finalizar nuestro periodo, una línea telefónica de prevención del suicidio, menor precio de medicamentos y más becas para estudiar psiquiatría. Además, estamos incluyendo hospitalizaciones para menores de 15 años con depresión grave dentro de las coberturas de nuestras garantías explícitas de salud. Y cuando pensamos en los desafíos de salud mental de manera integral, como deben pensarse, vemos que potentes son las acciones de justicia social, como por ejemplo, reducir la jornada laboral permitiendo más tiempo para el ocio y para la familia, subir los salarios o mejorar las pensiones. Además, en 2024 presentamos un proyecto de ley integral de salud mental que aborda esta materia como un compromiso de Estado. Estamos felices de contribuir con nuestra experiencia, compartir nuestros aciertos y nuestras dificultades, para que en toda América podamos avanzar en este asunto que es tan relevante para nuestros compatriotas, para que juntos podamos construir un futuro que sea más inclusivo y más amable. Muchas gracias por esta invitación. Estoy seguro que nuestra viceministra de Relaciones Exteriores, Gloria de la Fuente, podrá responder vuestras preguntas sobre los avances que estamos impulsando para asegurar que la salud mental sea un derecho para todos y todas. Les envío un afectuoso abrazo.
I would now give the floor to Her Excellency Gloria de la Fuente González, Vice Minister of Foreign Affairs of Chile.
Muchísimas gracias y parto saludando al excelentísimo señor Gastón Brown, primer ministro de Antigua y Barbuda, al señor Moulin Joseph, ministro de Salud, al señor Albert Randim, secretario general, y al señor Néstor Méndez, secretario general adjunto. Tal como señalaba nuestro presidente, Chile tiene un compromiso de larga data con las políticas públicas de salud.
Thank you very much, Mr. Chair. Sir Moulin Joseph, Prime Minister of Antigua and Barbuda, Gaston Brown, Secretary General Albert Ramlin of the OAS, colleagues, excellencies, distinguished guests, good afternoon. A very special thank you to our distinguished speakers for their contributions to today's session. The region of our Americas is undoubtedly in the midst of a mental health crisis. Millions of people in our region, from all countries and walks of life, are living with a mental health condition or have a personal connection to someone who is, including the Honorable Gaston Brown, the Prime Minister here in Antigua, who bravely spoke of his lived experience today. I think we should put our hands together for PM. The impacts of mental health conditions are significant and widespread, and they do not stop at health. Mental health is vital to all areas of our society, including the core pillars of the mandate of the Organization of American States. We cannot speak about integral development, human rights, and security without taking mental health into account. Therefore, it is time for mental health to be part of the political agenda for the Americas. Working together, we can drive progress in mental health for the Americas and beyond. As Secretary General Ramlin pointed out, with the upcoming high-level meeting on the prevention and control of non-communicable diseases and the promotion of mental health and well-being taking place in September, this is an opportune time for the region to leverage our collective commitment and efforts to influence the global mental health agenda. Each and every member state has a vital role to play in advocating for mental health at the highest levels to ensure that it is at the forefront of our policy discussions. Today's side events represents a key step toward making mental health a cross-sectoral priority for our region. I'd like to thank its organizers, Government of Antigua and Barbuda, and the Pan-American Health Organization for making this very important dialogue possible. Thank you very much. Let us reaffirm our shared duty and commitment to addressing mental health in the Americas so that united we can truly thrive. Thank you very much, and God bless us all.